I'm James Thomas, I'm Director of ICT for UCL Hospitals in London, a group of 7 hospitals, history of being merged, £700 million turnover, about 8,000 staff, multiple campus sites. The challenge for us was the fact that we are through mergers and acquisitions. We had a legacy of infrastructure which was all point solutions from different hospitals, approximately 21 different contracted providers doing all the different elements of it. The necessity for us was to find a solution how we took that forward and ended up with a world with unified communications. Azzurri was the strategic partner that we selected for this. We architected a managed service contract which swept all of these elements up, delivered technology refresh for us, it delivered significant financial savings for us on a recurrent basis, but it also delivered an innovation partner for us as well, because we didn't want to just repair what we had, we also wanted a platform where we could move forward and actually start leading in the UK. We have been highly successful at driving forward the Bedside Connect, which is a really innovative patient delivery and entertainment system. We've also now been the first ones in the UK to put in private mobile network provision, which for us in emergency scenarios for 7/7 bombings, etc., will put us as an infrastructure where we'll have hundreds of mobile workers still connected, as opposed to tens of mobile workers connected, which would have been our previous environment. We definitely believe this has now resulted in UCLH being the leading trust in the UK in its use of telecommunications and ICT technology. Okay, so the challenges that the organisation were facing when we started this, we'd got an inheritance of a disparate collection of different contractors. There was almost 21 different providers in place, and this was from a range of telephone providers, mobile providers, probably more critically for us though, pagers and bleep providers. We had multiple different paging systems across the estate, and this is through a legacy history of acquiring different hospitals. We had an absolute desire to have an innovative technology platform moving forward. We have quite clear plans to leverage that infrastructure for our day-to-day operations, but also within the emergency scenarios that we work as well, as a major emergency receiving centre in London. So we had an absolute necessity to change the environment we were in into one which would support these operational needs for us. The choice that we had, obviously we're tied public sector through procurement frameworks, but when we were shortlisting the various providers under the procurement, Azzurri was one of the list, and we'd actually had a previous smaller engagement with Azzurri where they came in on our first PFI hospital and actually diagnosed and resolved some very critical issues we'd had with the Mitel telephone infrastructure, and that was very time bound. Obviously a PFI hospital has to open on a certain date, and all previous attempts to actually eradicate the technical issues within the new PFI hospital failed, and really a combination of Azzurri and Mitel Direct, the pair of those actually managed to permit us to open the hospital on time. So there was a known history to Azzurri's delivery. The arrangements that we had in place were quite extensive. It covered a very large managed service contract and a lot of technical issues, and also a programme to actually take forward the way in which we served our patients with entertainment systems. Azzurri have had all sorts of communications and interactions with us from very technical, but also right the way through to actually trying to manage with the business users in different operational areas. The approach has been very good. The team that they've put in here has been very well mixed. We've got very good technical resource we can pull back from central Azzurri, but the service facing side of it that we have with the local team here have been very good. They've actually got inside understanding what a large acute hospital is about, what the drivers are. There's some things which are absolute emergency, urgent priority, and other things that can wait. And they've worked with us to actually try and establish those relative priorities. The solution initially comes as that which is contracted, so everything's bound up in quite clear definition over what needs to happen, and there was lots of technology refreshes, mergers of contracts and amalgamations of suppliers, etc. That side of things really is pretty much agreed before you sign up to it. What was inherent though was also we needed the innovation, and so some of the areas were actually defined really in what would the desired outcome be, and the finite detail of the technology was not actually agreed at letting the contract. And then post-letting the contract, as we worked through, we were then investigating how these particular items might be delivered. One example for that would be the private mobile network, which initially there was a set of third parties which Azzurri are going to work with to deliver this. This was going to be the first in the UK. And unfortunately, as we got into the detail of it, it became evident that they were actually unable to deliver what we needed. And so Azzurri's gone off and they've gone back round, and actually they've gone back to RIM and people like that internationally, and come back with a consortium of products which delivers the solution for us. So we're now able to take that forward. The solution came in several different forms. We have various different products areas, if you like, that we take, so core telephony, but also we have a bedside patient entertainment side of things as well. The main components of the telephony side of it was predicated on the fact that we used Mitel technology when we opened our main PFI hospital in 2006. So it was seen that with Mitel's focus on the healthcare industry as well, it was no sense whatsoever in taking out that which we'd already got of new technologies, and actually to build on that and take that forward. So engineered into the way in which we were engaging was the necessity to drive Mitel through as the single source of system for all the telecommunications side of it. On the bedside entertainment side of things, we had used patient line in our primary PFI hospital, but we don't own the contract with patient line, and we have no ability to interact with it or drive the services at all. So we were adamant with the way that UCLH works, we need to be in control of our destiny, we like to influence things and leverage the technology. So we wanted to bring in another provider. So Bedside Connect, which was the solution which was being put forward by Azzurri, was one that we could then jointly actually take forward. We could leverage it to be able to use it for our patient entertainment, our patient information systems, as well as the patient entertainment systems. So it would extend our footprint and become part of our infrastructure under our control. The project now is 2 years into its implementation and delivery. We have a very regular contract review meeting, which is on a monthly basis. We have good documentation that's actually presented to that. The format of that documentation has been jointly developed, so there was a framework within the contract of minimum information which was made available, but we've actually evolved that so that we're now providing information which is relevant to evolving issues as we go through. As the project's evolved, the type of activities Azzurri have been involved with have changed from purely some technical implementations. They now actually have been through an exercise of cleansing the whole of our telephone directory across 7 hospitals as well, which gets them absolutely integrated into operational business, trying to coerce time from very busy people, clinical worlds, etc., to actually feed information back. And Azzurri have been able to report on that, so we get data quality reports around where we're going around those exercises of the data cleansing as well. At UCLH we have a broad mix of different products because of the scope of the service overall. I think probably you start with the fact that all our core telephony now is all IP based telephony. It's all on the Mitel product range. We've managed to transpose over everything of our legacy through to that, so that's really, really good. We're certainly working with Mitel about new features in the future, and that helps drive our unified communications agenda quite strongly. They've got a good focus on health as well. Around that we have other communication services that Azzurri provide for us over and above the Mitel. So we have pagers, which is our long-range pagers for all our clinicians, etc. But we also have bleeps, and bleeps to us is a critical thing. So this is your cardiac bleep calls, etc. So these are in campus, in site, needing immediate response. And where we started before Azzurri were involved, we had 3 different providers of bleep systems, etc. So even trying to bleep a colleague within our campus of hospitals had complexity to it, and you've got the potential for the wrong bleep number being used, etc. So it's been eradicating some of the clinical risk that we carry as well because of our history of merging different hospitals. We have mobile users, so we have mobiles and BlackBerries. We have somewhere between 700-800 mobile devices provided on trust devices now, and the absolute necessity is to bring those in a more integrated way into our infrastructure. Obviously the BlackBerry devices have a very good security framework around them, and that security framework is becoming a minimum requirement for us in our mobile users. And one of the areas that we've strived to take forward with Azzurri was the idea of being able to put in a private mobile network. So when we have 7/7 bombings, environments, etc., when public cellular networks are switched off, we want the ability to be able to maintain our own cellular style networks and actually be able to keep those 700-800 users online and able to communicate when you most need that communication. So our private mobile network side of things is absolutely driving forward data integration, secure integration through RIM with the private mobile network provider that we've chosen as well. On top of that, away from pure telecoms, then comes all the patient entertainment products that we use. So we've gone with the Bedside Connect products. We have experience of others. We have Patient 9 already in use within UCLH hospitals, but Patient 9 is not a contract that we can own or use ourselves, and as a result of that we have no control over tariffs which are charged through this at all. With the Bedside Connect we can completely control the tariff, so if we wanted to we could actually reduce the tariff or provision it for free to the actual patient if it's going to help actually their stay, their encounter, and improve clinical outcomes for us. It's also far more under control as becoming part of our infrastructure. So we can integrate it into the infrastructure that we deploy clinical solutions through. We're currently rolling out an e-prescribing, a medicines management system across the trust, and we intend to use the Bedside Connect device as one of the points of access for clinicians when they're actually prescribing pharmacy doses, etc. for a patient. I think the benefits for the trust probably come in 3 categories. So we have benefits from a technical perspective, we have benefits for the clinical workforce, the consultants and the nurses, and also benefits for the patients. The technical benefits, we obviously have a much better supported solution than we had. We've moved from a world where all our hospitals were supported by 2 engineers Monday to Friday, to a world where we have service levels, we have guaranteed engineering support from the Azzurri organisation. We have a single provider perspective on things now. So if we have technical issues, actually the telephone system's not working with the paging system, etc., single point of contact, single point of escalation, single point of resolution. That's a phenomenal increase in management, reduction of effort from our side, but also in responsiveness and the time for actually fixing things. We've had significant financial gains from this, one-off up front, cost avoidance, but then also actually reduction in costs as we move forward on call tariffs, etc. And all these things actually being underwritten, so there's a risk transfer that's gone on through this. When you look to the clinician has received gains, etc. for themselves, so they're seeing less failures of the telephony systems. So we for the last 12 months, I can't recall any significant failure in telecommunications since we've actually transitioned the infrastructure over to the new technologies. So they're seeing guaranteed ability to be able to call people. They're seeing quality data of information coming through now as well. So as we're refreshing the estate, we're going through and actually refreshing all the telephone numbering systems, telephone directories, etc. So you have a single point of reference. You're able to actually find the person you're after as well. We're also, for the clinician perspective, we're removing a lot of the confusion around how you contact people. We used to have different numbering regimes in different hospitals, and we're moving to a single-digit, 5-digit numbering regime, so the same extension won't exist twice. and it removes a clinical risk as well. So actually bleeps and things like this, they are not duplicated across our estate. They are absolutely unique, which removes any human error potential when calling an emergency bleep, etc. So these are all huge gains for clinicians from a patient safety perspective and clinical outcomes. When you look at the patient's experience here, we've actually strived to try and change that for them as well. So the Bedside Connect device, which they have, is certainly seen as a more friendly environment for the patient to actually work with and interact with, use it for their movies, for phones, etc. They can also get information back about particular health conditions, advisory information around the patient as well. So that's a huge advantage for them. Contacting the trust is something also that the patient is now starting to see that's changed as well. So working with Azzurri, we've refreshed all of the technology for our switchboards. So our switchboard agents are able to diagnose a caller and where they need to go to quicker, but also we have voice recognition software which has been put in place and upgraded, etc. So we can take volumes off of the switchboard. So internal callers who are looking for another member of staff in the trust, they can use the voice recognition, which frees up our switchboard agents to actually deal with patient calls who don't know quite where they're going to and what the calls are. Also, we've worked with our call centres, so we actually have a call centre structure within the trust. So if you're trying to make arrangements about your outpatient appointment, etc., and that sort of thing, and you have an issue with a date, we've now created the virtual call centre, so we've been able to spread the load across the people. We have far more intelligence about the profiles of how people call during the day, so we've been able to resource the call centres better. So the patient experience of calling in has been increased as well. ROI for us is very, very important. We live in an incredibly financially challenged environment now. The return on investment came in several shapes and forms for us. We knew that we had an incredibly dilapidated telephony infrastructure, diverse different providers. There was a significant amount of investment we were going to need to do just to get us to a minimum standard. So we were able to demonstrate that we deferred at least £1.7 million worth of investment through letting the contract, because the contract had the refresh elements actually built into it and underwritten from Azzurri's perspective, so there was a significant cost avoidance. Inside that, then, within the contract, there are significant revenues ongoing that we have to pay, etc., and service. A lot of these are focused around call costs. So we have a significant bill for our monthly call costs that we're incurring. On signing the contract, Azzurri actually underwrote a significant reduction to that call cost tariff for us. So literally on day one of signing, we got an immediate reduction. This is without us needing to change any of our behaviours about how we call, but this was true risk transfer with Azzurri. Engineered on top of that then is the fact that every year we also get a minimum 15% reduction in all of our call cost tariff basket moving forward. So the cost of the contract to us year on year gets less as we live with it. That requires us to make sure that we put any policies and any policing in place, which we've certainly achieved through the first 2 years. And also there is an incentive from both Azzurri and the trusts to keep pressing away at trying to find costs in this, because there's a profit share arrangement. So if we overachieve over and above the 15% reduction, then actually we split that between Azzurri and ourselves in further savings. So it's in both parties' interest to keep chipping away at behaviours, use of technology, etc. I think the other area that we addressed, which was a concern for us, was the use of mobile phones and Blackberries. We have a reasonable user base, 700 plus, and the rigour with which of actually identifying and claiming back personal calls was nowhere near where it should be. We had concerns around auditability, etc. So Azzurri have deployed a portal and technology for us where each individual mobile user is now presented back with a personalised bill. The bill actually learns month on month, so if you identify specific recurring numbers, it rolls those forward for you. And every user's had to sign up, so actually any personal calls highlighted are then directly deducted from payroll. So it's all electronic transfer of funds, etc. as well, which is good for us. And the ability for us now, we have a robustly auditable situation as far as customs and revenue are concerned as well. I think the unique thing that we found with Azzurri, we have many strategic IT partners. I think the one thing that Azzurri have done is they've kept themselves agile with the ability to be able to change. When you get into long-term contracts, 7 years, 10 years, etc., it's very easy to focus on what was originally perceived as needed at the beginning of the contract period. We all live in an environment where your business changes. The one thing that Azzurri has been able to demonstrate over the first 2 years of living with them through this contract is the ability to flex and review to make sure that the services that we're trying to provide still match the business needs of where we are. My advice would be, whatever you do, don't lose that inherent flexibility. I think the reason that we've used Azzurri, and therefore the reason probably I would recommend Azzurri moving forward, the arrangement with Azzurri and the relationship with Azzurri has drastically reduced the amount of complexity for us in actually delivering integrated unified communications for the trust. The management overhead for us now is significantly reduced. We've managed to transfer the risk to Azzurri in a very successful way, and we've seen demonstrable delivery against that. So it's not transferring risk and then concerned over it. It's transferring risk and seeing really positive delivery on that. But that's in a culture where they're also continuously trying to evolve and innovate for you. So actually you're bringing in a partner which wants to innovate the way in which your business runs for you. For us, that's resulted, we absolutely genuinely believe we are leading the UK now, health sector, in how we use communications, mobile communications, etc. And that's demonstrable through several firsts that we've now been able to put in place as a result of the work with Azzurri.